I am a program director at ServiceNet Outpatient and the leader of the OCD and Hoarding Disorder Program. The OCD and Hoarding Disorder Program at ServiceNet is a team of clinicians treating OCD and hoarding disorder in our outpatient clinics throughout Western Massachusetts, providing the gold standard best treatment for these disorders. About 2 to 3% of the population is affected by OCD. So everyone has intrusive thoughts, but OCD is a catastrophic response to a normal intrusive thought. It becomes an obsession and it causes high levels of anxiety and distress, and they feel a need to do something in order to relieve that anxiety. People are coming to treatment because they're in a lot of distress. The compulsions are sometimes getting in the way of being able to interact with loved ones, being able to go out in the world. Hoarding disorder is a related disorder to OCD where a person has an attachment to things and can lead to cluttered living spaces that impede people from being able to utilize them as intended. The word hoarder is a stigmatized word. It really has a lot of negative connotations. If you have hoarding disorder, it's a mental health diagnosis. They're really struggling with an attachment to these objects. The way in which hoarding disorder and OCD are different is that collecting things tends to give people pleasure, whereas with OCD, the compulsive behaviors that people are doing are not giving them pleasure, they're just an attempt to alleviate pain. Where they're kind of similar is in terms of the treatment. Both treatments are building up a capacity to tolerate distress in order to get to a desired outcome. In our program, we do exposure and response prevention, ERP. We spend a lot of time really understanding the way OCD is showing up for a client. We expose the client to the intrusive thought, to the obsessive thinking, and then work with them to not engage in the compulsive behavior in a very supported and sort of planned out way. And it gives them the opportunity to learn that they can tolerate maybe more than they thought that they could. In treatment for hoarding disorder, we support people in knowing how to organize, developing skills for sorting, discarding. We try to test out the fears and see what the actual outcome is and learn from those experiments versus just a feared outcome. So we want the focus to be more on what to save versus what to get rid of. After a person's completed an exposure, they often feel really proud of themselves, really elated. We see, more and more ability to start doing more things in their lives. It's been really rewarding to help people do an exposure that was one of their biggest fears in their whole life, to face that fear. I mean, the bravery that these clients show, it's really powerful. And eventually we want them to create sort of a culture in their life where they are moving towards hard things until they're able to live their life as freely as they want.